Let's get started right away. Who we are, many of you already know who we are, but I want to make sure that you all understand that we have different types of companies because you're going to be getting emails and communications from these different companies, and they all have to do with the same. They all have to do with helping you somehow to make more sales, make more money. So we have Premier Insurance Contracts, which is the FMO. That's the company you get contracted with. Then you have Wealth Management Solutions, which is our e-commerce platform. And that is going to be very important into the future because with that platform, you can embed inside that platform a quote engine and you can enroll people directly, and then you can do digital marketing and send people to your e-commerce platform and enroll them there. So Wealth Management Solution is all about your e-commerce store and your digital platform. Then we have the American Institute of Financial Education, which is an educator, and it provides education to you as an agent in terms of continuous education, but also you can become an educator at the American Institute of Financial Education and educate clients on topics like ACA. So that's an application of the American Institute of Financial Education that you can use to make sure you enhance your business. We have Cashback Universe, which is our cashback platform. And then we have the American Institute of Digital Marketing, which is the umbrella under which we provide you with all the knowledge and the elements and the tools for you to be able to perform and to sell using digital marketing. And in this training that we're going to be having over the next couple of weeks, we're going to show you a lot about how to market in this new environment and with this new reality that we have today. So again, different companies, and you're going to get communications and requests and information from different parts of our organization. Again, always with the intention of making sure that you sell more. My role in the organization, I'm the CEO of Premier Insurance Contracts. I'm a CFP, Certified Financial Planner, obviously a licensed insurance agent. By the way, I'm already grandfather, so I have had my license for more than 20 years now. I have a master's in financial analysis, a master's in financial planning, and a postgraduate diploma in digital business that we have been using to help you develop many of the tools that we're using today to help you sell more. Our track record, we have had a good track record. As Premier Insurance Contracts, we started doing business in 2005, and in many instances, we have been a top producer at a national level, either for Medicare Advantage or for the ACA. This last year, we were a top national producing agency for Amber Centene in 2019, and our expectation is that this year we will also be there. And now we're getting ready to make sure that we continue being there into the future. So I wanted to show you this track record because we have learned how to do this. And although there are many different challenges, and I'm going to be talking a little bit about that in this training and in the trainings that we're going to be having over the next couple of weeks. Again, we have been able to identify the issues and prepare ourselves, position ourselves in a way in which we can solve whatever new situation develops in the future. And believe me, there are going to be many things happening over the next weeks, months, and in the next couple of years that might substantially change the business. But what we have learned to do is to make sure that if we have the right capacity and we foresee what is coming on time, then we position ourselves to make sure that we make money no matter what happens. And we need to start doing that as of right now. So part of this training, I'm going to be talking to you about the things that you need to do to make sure that no matter what happens in the next couple of weeks or months or next year, you can continue making money associated with health insurance coverage for your clients. So, but we need to make sure that now we do many different things, and that will not guarantee us anything, but would allow us to make sure that we continue, producing a lot for these different carriers. So again, our track record is there, but we want to make sure that we keep it that way, and this training is part of that process. we have a lot of things to cover, okay? Basically, and I know you cannot see this very well, but I just wanted to make sure I put it there. We're gonna have a couple of different sessions. So we have here 4 sessions. And again, we're gonna do these 4 sessions, and we have basically 5 weeks to cover all these 4 sessions. So we're gonna play it by ear in terms of how much we move. Basically, each one of those sessions, we're trying to shoot for 1 hour, and it's gonna be every Friday, okay, from 10:30 till 11:30 every Friday. So we have these 4 sessions. But again, we're gonna go over five weeks. So in the last week, we might just review a couple of the things that we have covered in some of these sessions, or we might just get started all over again and just continue doing for annual enrollment. But in session number 1, which is today, we're gonna be talking about the marketplace replacement, what the influences of COVID-19, the connection with Medicare, the potential income that we can make. And then we're gonna talk about the registration process for new agents and the registration process for returning agents. We wanna make sure that everything is in order there. This is the time to do that. If you have already done, it's gonna be just a reminder, and then we're gonna show you some tools on how to verify that everything is in order. And if you haven't started, we're gonna show you, we're gonna provide you, not only show you, we're gonna show you today, but we're also gonna provide you with step-by-step guidance in terms of what you need to do for both cases. And we're gonna spend a lot of time today on this 2021 ACA product review, which is something that I really want you to start working on. And then I'm gonna give you some homework. We're gonna have some homework, and we're gonna be talking about that later today. Then we have session 2. And in session 2, we're gonna show you some of the resources that we're gonna be that are available for you, and that we're gonna be providing you that at no cost. And then we have a very complete ACA presentation that is gonna cover many aspects of the ACA, things like the cost structure of a health insurance plans and SEPs, and something that is very important and new this year, health reimbursement accounts. And we're going to talk about the federal poverty level chart tables, and we're going to talk about an option where you can. We want you to make sure that this year, for the first time, you position yourself to sell at least 2 products in this process. So we're going to be talking about that in session number 2. Then in session number 2, we're going to be talking about marketing. Session number 3, we're going to be talking about marketing. And first and foremost, we're going to be talking about digital marketing. Now, that digital marketing training on session number 3 is accompanied by our training on digital marketing that we have on Wednesday. So I invite you all to make sure that you register for our Wednesday trainings on digital marketing under our AMIDIM platform, and I'll give you information on that today. And because we're going to start next Wednesday with ACA marketing using digital marketing. So again, this training on session number 3 about digital marketing, we're just going to cover the basics of it, but make sure that you join our weekly trainings on digital marketing, because we're going to be all about ACA digital marketing in the next 60 days. Okay, so again, we're going to be covering that. Then we're going to have, we're going to talk about help on demand, and we're going to talk about the circle of champions, which is an important thing. And we're going to talk about what CMS resources are available for agents, and you need to learn those tools, because there's a lot of really good things there. So you need to make sure that you use all the resources available to you to make sure that you are productive. And then we're going to make sure that you learn how to verify that everything is in order. We're going to show you some of the tools that you have today to make sure that everything is in order, your certification is properly registered and everything. And then on session number 4, and remember, this is on a weekly basis, so session number 4 is going to be sometime at the end of the month, okay? And that's going to be getting us very close to annual enrollment when it starts. But the important thing is that we're going to start looking at the different products from different carriers. By that time, we should have a lot of information on that. And then we're going to talk about quote engines and how you can use quote engines to give quotes to your clients. And again, since we're going to be covering that on digital marketing, so we're going to connect quote engines with digital marketing so that you learn how to use that. And then by that time, we're going to have absolute clarity in terms of what is the best way to enroll clients in 2021. Sometimes we use Health Sherpa, other times we use our own code engines, other times we use directly with the client in the marketplace. There are issues there because probably some of you that have already completed the training, they emphasize the fact that you cannot be entering into a client's account. So we have this document that we are going to provide you so that you can tell your clients to give you an authorization for you to represent them in front of the marketplace, and that way you're going to have more flexibility doing things. So we're going to be talking about ways on how to enroll clients in 2021. And again, we want to make sure we cover that material as far into as close as possible to the annual enrollment so that we have the most amount of information possible. So we have a lot of material to cover, and I wanted to make sure that you know this, because you might come out of this session and say, well, I didn't learn about this or I didn't learn about that, but I wanted to make sure that you understand that we're going to be providing you a lot of information, and we want to make sure that you take it and you digest it. So we're going to have these 4 sessions, and it's a very exhaustive process that we want to go through. Okay, so let's get started with the marketplace enrollment. So far, we have had a really interesting situation. This is let me change this to this here. Oops, I'm sorry, I went to the next one. Okay, so here, there we go. Okay, so we started in 2014. That's incredible. 1, 2, 3, 4, 5, 6, 7. We're on an 8th year now. It's incredible how time goes by. But anyway, when we started, and again, this is the whole of the United States. We had 8 million people enrolling into the marketplace, and it went all the way up in 2016 to 12.7 million, and then it went down a little bit, and at the end of annual enrollment last year in 2020, we were at 11.4 million people in the marketplace. So this is the behavior that of all enrollments into any type of marketplace across the nation, and this is what has been happening. And this is the graph for the state of Texas. Okay, so here we have Texas. We started with around 700,000 people in 2014. It peaked in 2016 at 1.3 million. And then it has been leveling at more or less 1.1 million people. And again, this was all the way to annual enrollment basically 10 months ago. But then we had an incredible situation happening. Okay, we had COVID-19 coming in March of this year, and that substantially changed, okay, the possibility of you enrolling people in the marketplace. Why? Because literally millions and millions and millions of people were terminated from their jobs, they lost their job, and they became independent, or they're still unemployed. And these people, they need health insurance. Now, at the beginning, people didn't know exactly what they needed to do. So they might have not made any decisions, or they were not clear of what they needed to do. But we have been in this situation for 6, 7 months now. So people know exactly where they are today. And they realize the fact that they need to make sure that they have coverage for them and their families. And they have more clarity in terms of the levels of income that they have with all the unemployment help that they're getting, or partial jobs, or new jobs now where they're independent, etc. So the point is that there is a huge opportunity. There is a huge opportunity with all these new people that suddenly entered the healthcare market as independents, with numbers that we have never seen before. And this is an incredible opportunity. This is an incredible opportunity. But on the other side, okay, we also have the fact that once they turn 65, okay, and I want to make sure that you understand this connection, because this is another line of business that I need you to start considering, is these people, once they turn 65, they enroll in a Medicare Advantage plan. So, and Medicare Advantage is also booming. So I just want to make a comment here of the fact that you should not let this opportunity go away. This is a very important opportunity where you can continue making money over many different years. Okay, so I just want you to keep that in mind. You don't want, when people turn 65, lose them, they drop your ACA plan and they go into a Medicare Advantage plan, and now you lose them. You're not making any more money with them. They go in another direction. Another agent starts servicing them, and you might lose a couple of different lines of business that you might have with these people. So I wanted to make sure that you understand this connection between the ACA market and the Medicare Advantage market, because it's very important. So the potential to make money with ACA is big. I just made this example at $20 per member per month. And what I'm seeing right now is more of a $22 per member per month for the commissions for this year. But again, I don't want to give any final numbers yet. But just to give you an idea, if you have 100 enrollments at $20 per member per month, that's more or less $2,000 a month. Okay, and that's around $24,000 a year just on your ACA business. If you do, 1,000 enrollments, then you're talking about $20,000 a month, which is $240,000 a year. And what I want to emphasize here is the fact that there is money to be made with this ACA program. Okay, so I want to make sure that you focus during the next couple of weeks to all the things that we're going to be telling you. And we want to make sure that you become diligent in doing what we're going to tell you to do, so that you make this money, so that it becomes a reality for you, that do not end up making $300 a month or $700 a month. You can make a lot of money with ACA when, if you do things right. So we're going to be working on a lot of things that we want you to do. Now, another important thing that is happening is that you have these substantially transcendental decisions and situations that are coming up again in the next weeks and months, and are going to change everything. They might change everything, or everything can stay the same, but you cannot take the risk of not being prepared for that. So yeah, if everything stays exactly the same, this would be a table for your scenario. But remember, we have this election coming up, which is going to be very important. And we have this issue about the Supreme Court, where they're going to be nominating somebody else. And basically, one of the things that we need to understand today, basically, this status of the Affordable Care Act has already gone to the Supreme Court once, and they ruled that it was not unconstitutional because of the fact that it had the mandate, but the mandate was eliminated. So now there is no mandate. So the point is that it is very probable that they will rule in the next Supreme Court meeting that the Affordable Care Act is unconstitutional. And that's going to really move things. But the way we see it, if you do things right, that's going to generate a huge opportunity for you to make money. So we need to make sure that we are ready for that. So this ACA potential is if everything stays the same. But if there are changes, and I personally believe, and obviously anything can happen, so I don't have any type of, view into the future that I have any type of certainty, but I believe that there are going to be some major changes coming up. And what I have learned is that when I'm properly positioned and I am doing things the right way and I have the right information with me, I can really make a lot of money when those dramatic changes happen. So again, the potential is there, but I really believe that there is potential even to make more money if there are other additional changes. So I just wanted to throw that at you. And if it stays this way, I want you to shoot for maybe 100 enrollments or 500 enrollments so that you make some decent money every month coming next year, from your ACA business. Additionally, it's 100 or 500 or 1,000 clients, and then you can go back and you can sell them other things. As you saw in the agenda, in session number 2, we're going to explicitly give you a strategy on how to sell 2 products to those individuals right there in the process where you are enrolling people. We're going to show you that, and again, we're going to cover that in session number 2. Okay, but we need to make sure that we do this right. Okay, the standards of professional conduct are more important than ever before. There are major changes with all this COVID-19 situation, where basically, I don't know if you can remember in the past, people would just place a desk on a mall and people would just line up to enroll in a program. And you had a lot of people that were not licensed and you had all these things going on. Well, a lot of those things have changed and they're not possible now because of the COVID-19 situation. So now more than ever, we need to make sure that we do things the right way and that we distinguish ourselves by our standards of professional conduct. So I'm not going to spend too much time on this today, but let's make sure that we have clarity in terms of all the standards of professional conduct that we need to follow. And let's make sure that we do it that way. We keep it that way. So again, an emphasis and a point in terms of the standards of professional conduct that are very important. But things have changed substantially. Okay, this is just what, 2-3 months ago, 4 months ago, Holy Mass in the Vatican, nobody would have ever imagined, an empty, huge church empty. And not only that, this is Joel Osteen here in Houston. He started preaching to an empty auditorium. And but this has generated opportunities. In the case of Joel Osteen, in that congregation that he has there here in the Houston area, he basically every Sunday had 40,000 people in front of him. Well, now that he's doing it online, he grew to 4 million people watching him online. So that just to give you an idea of how his business grew, okay? So the point is that this COVID-19 new reality is creating all these changes, and you need to understand that you need to adapt to that new reality to make sure that you make money. So you need to adjust, you need to incorporate into your business, digital business, and you need to start thinking that now it's not just about selling in your area of influence, your neighborhood, or your part of town. Now at least you need to think Texas, minimum Texas. You have a license to sell in the state of Texas. So at least Texas, and then you should include some additional states. So you have to change the way you are thinking because things have substantially changed. Now, that being said, you need to make sure that you don't exaggerate. This is a picture of an agent getting ready to go and visit a client, okay? So, and they said that is one of our agents. So we're doing this investigation to see who he or she, I think it's a he, but anyway, who he or she is, okay? So the point is that you can, you shouldn't exaggerate, but you do need to adapt to this new reality. You have to have a combination of the ways you used to do things, plus you need to add some new things to make sure that you are moving at the right speed in terms of what needs to be done to not only keep your book of business, but additionally to grow your book of business. With those numbers that I show you in a couple of slides before, there is this huge opportunity of new people out there, and you need to make sure that you take advantage of that situation, and this is the time to grow your book of business. Now, additionally, this is a really important time because you don't want to enroll somebody and just process their ACA and not even meet the clients, just have a little phone conversation. No. This is the time to really connect with those individuals, because if those changes that I'm talking about come about, you are going to need those relationships to move those clients to whatever new scenario we have in the future. So this is the time to connect with your book of business. You really need to make this personal with your clients, okay? You really need to make sure that they know your name, they know how to contact you, that they have your email, that they have your e-commerce platform address, your landing page address. You really need to make sure that they know you well, because if all these changes come about, they're going to be very confused, they're going to be very nervous, and you can provide them with guidance and information, and you can make a lot of money in doing so. So again, we need to make sure that we are ready for everything that is coming, and part of it is changing the way we interact with these clients, because we really need to connect with them on a personal basis, getting ready for whatever scenario is coming up in the very near future. Okay. Okay. So let me. We have the Prinsuco website, and we have a lot of resources. And as I mentioned in the agenda, we're going to be covering all of the resources later on. But today, let me get started with something very specific that I want you to get started with, okay? So this is the Prinsuco website, and there are a lot of resources. We have all these different tabs here, and you can play around with all these tabs, and it will drop down menus, and there is a lot of information and a lot of materials and a lot of things there. So again, it's www.prinsuco.com, and that is the main page, the website for Premier Insurance Contract. And for the exercise that we're going to be doing right now, okay, I'm going to show you, and I'm going to go there, and I'm going to download a couple of documents that you're going to use in order for you to continue what we're doing right now. So again, this is a website. Make sure you learn how to use it. Make sure you use all the tools and resources that we have there, because we have invested a lot of tools and capacity into this website for your service. Okay, so we're going to go there to www.prinsuco.com, and I'm going to show you now how to get this page here. And everything here, each one of these different lines here, it's a link to some place that you're going to be needing in the near future. Everything that you see there, you will be needing. You're going to have to use for something in the very near future. So again, I'm going to show you now how to go there. What I want to start today is with these two. Let me just change this here. These two tabs here, the 2021 Health Insurance Marketplace Registration and Training for New Agents and Brokers, for new agents and brokers. And then the one just below it is Health Insurance Marketplace Registration and Training for Returning Agents and Brokers. So there is a difference between a new agent and broker and a returning agent and broker. In many instances, I have talked to agents and say, okay, how was the certification? Oh, really long again. I said, what? Well, guess what? Nobody told them that there is a section for new agents and brokers and another one for returning agents and brokers, and there is no need for you the new agent and broker registration if you have already completed that registration in previous years. Okay, so very important that, and I'm going to show you exactly where to go. What I'm going to do is, for those of you who are new, I'm going to just show you, and I'm going to go over a couple of slides for the new agent and brokers process, but I'm going to spend more time on the returning agents and brokers, because there are several things there that that you need to make sure that you know about. So again, I'm going to get out of this one here. I'm going to go to our website, and I'm going to go to prinsuco.com, as I mentioned to you before. Let me go here. Let me open another one. So I'm going to go to www.prinsuco.com. Prinsuco.com, enter, and there we are. And I'm going to go here. Let me make sure I close here. I'm going to go here to marketing and sales, ACA marketing, and then ACA sales tools. Okay, so let me repeat that: prinsuco.com, marketing and sales. So this tab here, then ACA marketing, and then to ACA sales tool. So I'm going to click there, and it takes me to the image that I just showed you. And again here, and I'm going to make this a little bit bigger. Let me just magnify it. Okay, here you have the tab that I was talking about. So here you have the Health Insurance Marketplace Registration and Training for New Agents, and then the Registration and Training for Returning Agents. So let me click first on the New Agent Registration. And this is a very detailed PowerPoint presentation prepared by CMS. Okay, it has 71 slides, and it gives all the instructions that need to be followed in order to make sure that you register properly. Okay, so it goes into a lot of details. Obviously, I'm not going to cover all these details, but now you know that it's there. Now, let me tell you, if you don't follow these instructions here, it can take you 3 or 4 days to get registered, because you're going to get completely lost in the process. Even seasoned agents that have to do it year after year sometimes get lost because they don't know where to click, or they click in the wrong place, and then they go to the wrong, they get into the wrong situation. Okay, so you need to make sure you follow this step by step. Okay, now what I want to emphasize first is the fact that you go here to this slide here. This is the process. Okay, there are 7 steps to it. Let me go back a little bit more. So it's on slide number 8. Slide number 8, you're going to have 7 steps that you need to go through. You need to create a CMS Enterprise Portal account. Let me create a CMS Enterprise Portal account, request the FFM agent broker role, complete remote identification. Okay, it's very important because remember, what you're doing here, what you're going to end up doing is you're going to be telling the federal government, hey, Mr. Federal Government, give $1,000 to this family. It's a gift. Okay, basically somebody, some person tries to buy health insurance, and the cost of the package that they get for them and the totality of their family is $1,200 a month, and you are going to tell the federal government, okay, Mr. Federal Government, give these people $1,000 so that they don't have to pay $1,200 a month, but just $200 a month. So the government needs to make sure that you are you and that you're properly trained and that you're doing this right. So that's why it's so important that they need to identify you. Okay. Then you're gonna complete the agent broker profile. So you're gonna tell them, hey, this is me first. Okay, that's identification. But then you're gonna tell them, hey, and I am an insurance agent that want to work in the ACA plans. Okay, so that is you define your profile with them. Okay. Then you complete the training. Once you are identified, once you are already defined as a broker, then you have to go through the training, and that would be step number 5. Then you need to read a bunch of documents, agreements where it says that you're not going to be doing this and this and these other things, etc. And then you need to make sure that everything is in order by you verifying that everything is in place. And again, as I mentioned in the agenda, we're going to show you later in session 2 or 3 how to verify everything and to make sure that everything is okay. And a lot of that is in the Prinsuco website. So you need to just learn the Prinsuco website, and you're going to go there. And many of the things that you need to make sure you go over are in that website that we just showed you. Okay. So this is the process for a new agent. It's very clear, very important. New agent. Okay. So if you are a recurring agents, recertifying agent, this is not the process that you need to follow. So let me just go through this one very fast here. And again, it goes step by step over the whole process. It tells you exactly what lines you need to choose, when you need to do it, okay? All the process, very diligent. I mean, they did a really good job. Then you need to create your FFM user ID. Make sure, and we have had this situation a lot, the FFM user ID, it's the ID that you're going to be providing your clients so that they enter that information so that you can get paid. So make sure that the FFM user ID that you create in this step, it's directly associated with your name or the name of your business. Don't just give it some weird name, because that's going to appear all over the place. So make sure when you create your FFM user ID and password, especially the ID, you need to make sure that it's directly related to your name. Maybe your name is already taken, but you can add a number or something. But make sure that it's something that that reminds people about you, because you're going to be using it a lot, and you're going to tell them. Okay, and I'm going to show you, like in session 2 or 3, when you tell a client, hey, put that FFM user ID at a certain place in your account, and I will get paid. And I will get paid because I'm going to help you. So again, very important, the FFM user ID that you need to make sure that it's easy for them to remember. So again, you go through the whole process. You need to make sure that you don't click any one of the wrong buttons here. Okay, so you created the account, then you request the broker role. You need to make sure you click again on the right place. If you go through any other path, it's going to take you to a completely different place. So you need to make sure that you know exactly which role you are requesting and which tab and where to go. That's the point about this, okay? And then, again, you have the whole process here. I'm just glancing through it. This is the verification process. They're going to ask you a couple of questions that you never knew that people had that information on you, and you need to make sure that you know how to answer them, and they're gonna, using some algorithm that they have developed, they will decide if you are you or you are not you. Okay, and if you are not you, according to them, then you have to go through an additional process of making sure you get identified. But if you are you, everything is okay. Then you go to start the training. You need to make sure that you register for the right program, and you do that here. And you're going to see two options: the individual market and the shop market. We don't do shop. So for your information, every time you see the word shop, stay away from it. Okay, we want to just do the individual market. So that's heads up on that. Don't do anything associated with shop. Okay, we don't want to do that. We have another very different line of business for that. Way more efficient. Okay, so now the other thing is here that when you get into the actual training, you have two options. You have AHIP, American Health Insurance Plans, and you can click here and access that training, or you can do the Marketplace Learning Management System from CMS. I strongly recommend you, absolutely recommend you to use this one here. This one has no cost. This one I have here has cost. Okay, so make sure you select option number 2, Marketplace Learning Management Systems, okay, and go through that door into your training. That way, it's not going to cost you any money. Years past, I went through this other avenue just to see it was, and I said, okay, let me pay, but let me see if I'm getting something that is really worth it. And it was a waste of money. Okay, so makes no sense to go through that path there. Go through the free platform that the federal government has for you. So that's an important tip there. It's going to save you time and it's going to save you money. Then you complete the whole thing. And again, step by step on that process. And you already know where to go to download this presentation. So that's why you don't have to worry about me going through too fast through it. Now, additionally, all these trainings are recorded, so you can go to the Prinsuco platform, and I'll show you that in a couple of sessions, and you can always look at these trainings and through a recording, okay? So you can do that. And then, so again, now you complete the training. And again, a lot of steps. You need to make sure that you follow these diligently, because if not, you end up in the wrong place. If you want continuous education, you can buy the continuous education. That's something that I recommend you to do. I mean, you're already going through the process. You're going to be taking you're going to be doing the certification. So it's an option if you have problems with continuous education. But if you want help with continuous education, shoot me an email and I'll provide you with some vouchers to give you some free continuous education. Okay. So do that before you start spending any money. Then again, you continue through the process. I just want to glance through these. These are, once you are properly trained, then you're going to sign a couple of agreements. And again, a couple of documents that say things about the commitment that you are getting into. And then you need to make sure that you confirm that everything looks right and that everything is complete. Okay. And then the proof of that is when you get your certificate. And this certificate is very important because we're going to be using this certificate in digital marketing. So I want you, this is the proof that everything is in order. If you cannot access this certificate, there is something wrong with your process. So you need to make sure that by the end of the process, you get your 2021 certificate, okay? And again, you're going to be using this a lot, and you're also going to be marketing using this certificate. So this is the proof of that. And they have a lot of resources. I'm not going to go through these resources now because we're going to cover resources more specifically in a couple of sessions. So let me go back, and now let's go into the returning agent presentation. It's a little bit shorter. Now, very important. Remember, I want to save you some time. So remember, the first one had 7 steps. Well, this one is not as long, okay? So the important thing here, there are a couple of new things. And this is one of them, the periodic data matching PDM, terminating coverage for dually enrolled consumers. And this is something that we will cover later in the course because this is going to become very important. This is people that have an ACA plan and turn 65 and they stay in an ACA plan, and there are going to be issues associated with that. So we'll learn about this in the training in the coming weeks. And then another thing that is really big is this new health reimbursement arrangements, these HRAs. This is big. And this is a huge opportunity, and this is something that we can work on next year. So this is something that we're going to cover in detail in the coming weeks. Health reimbursement arrangements, very important, and you're going to see something about it in the training, but very superficial. So it's not going to teach you anything, but then we're going to make sure that we cover it in the training coming up in the next couple of weeks, okay? And then, again, so you go through the process. It's only 4 steps instead of 7 steps, so it's shorter. And also the courses are shorter, so it's not just less number of steps, but also shorter courses, because they assume, hopefully, that you already know part of what you're reviewing. Okay, and that's the process. Again, the presentation is there. Make sure if you get lost or you don't remember a part of it, you can always go to the Prinsuco website and download this presentation, okay? And make sure you get the whole thing. Okay, so I'm going to just finish that. Again, remember nothing about shop. I don't want you to get into shop for anything. And there are some resources at the end. I don't want you to pay attention to those resources, because we're going to be covering those resources in a upcoming presentation. So let me get out of here. I'm going to go back to our actual PowerPoint presentation. I'm going to go here, and I'm going to go back here. And then, so the last thing that I want to spend the rest of the time here today doing this, I'm going to go to what I want you to focus on now, which is the 2021 ACA product review. And I want to spend some time with this document. Okay, so let me show you first where you get, and you might have another version of this, so this is not written in stone, but it does include everything you need in order for you to enroll somebody properly in a plan. Let me show you where you can download this form. So again, you're going to go to the Prinsuco website. You're going to go to the Prinsuco website. Again, let me do it again, because I want to make sure so you're going to, let me get to the home page here, and you're going to go to marketing and sales here, ACA marketing here, and then ACA sales tools. So you're going to click there. And again, you're going to land here, and then it's the first link, the 2021, let me make it bigger here, 2021 ACA product review. So I want you to click on it, and it's going to open the document for you. So I'm going to work on this document. Let me make it a little bit smaller so that it fits on the screen. And I want you to first see the whole thing, and then we're going to get into the specifics. But again, as I mentioned before, this document is, everything there is important. So you need to know everything about this document. If you don't know one of these concepts here, you are leaving something important out. Now, let me remind you what I told you before. This year is critical, because you might not have, listen to what I'm going to say, you might not have an ACA law come November, okay? It might be unconstitutional. So no matter what the political position is, if it's ruled unconstitutional, which again, we'll see what the determination is, but I believe that's going to be the case, you cannot continue working with something that has been pronounced unconstitutional. So something else is coming up. Well, guess what? If something else comes up, that's going to disturb everything. And this document here is going to be very important for you to be able to present alternatives to your customers and get them into something else. So that's the importance of this document here. You need to make sure that for each prospect, or for any client that you have, okay, you have one of these forms completed. Very important, okay? And just before we get into the specifics, it has some, and let me make it bigger here. Let me zoom in now. In the upper part, it has information about the family, okay? Make sure you capture everybody's name. And if there's more than 5 members in the family, then add some additional, in the back, or get another one, etc. But make sure you have everybody's name properly spelled, and make sure you have their date of birth, okay? That's going to be something that is going to be very important. Additionally, you need a current address, okay? Current address and a current email. Okay, and if you have information, and again, we're going to provide you with a power of attorney document where people are going to give you permission for you to interact with them. And if you have that, you can also include that information there. Okay, so that's the upper part of the form. That's the upper part. Make sure that for every prospect that you have and for every client that you have, you start preparing one of these. Because what you're going to do now is you're going to go to the lower part here, that I'm going to make it a little bit bigger now. Okay, and I want you to, if you already have the information for part of this, for the current plan, then make sure you complete it for them. Make sure you complete it for them, because this is what we're going to be using. We're going to make sure that we know exactly what they presently have before we recommend anything for next year. And by the way, this is what we call our November list, something that the seasoned agents, the people that are making $10, $15, $20,000 a month by selling ACA, what they do is starting at the beginning of the year, so come January, they start building what they call, and this is something that we created many years ago, your November list. Okay, so you start getting people for your November review. So you start in January, in February, in March, in April, May. Obviously, it's too late now for you to have a robust November list by November. But that does not mean that you should not start. If you're starting, get started, because you're going to learn how to do it. And basically, the idea is you tell people, hey, do you have health insurance? Yes, I do. Okay. I am a health insurance agent, and I basically represent all the plans available here in this region. And would you mind if come November, I get in contact with you to help you review your plan for next year? I will make sure that you get the best fit for your situation. Okay? There is no a best plan, but there is always a best fit, because different things happen, and some people, this might be the best plan for them, and for other people, this might be the best plan. So there is no, in general, one plan that is better than the other. They're just fit, that because of their situation, this is the one for this person, and that one is the one for you. You should not say, I'm going to give you the best plan. I'm going to look for the best fit for you, the thing that is tailored for you, okay? So, and normally, since it's 5, 6 months away or 3 months away, they say yes. So you capture their email. Okay, that's very important, their full name and their email. And with that, then you are in business. And the idea is that you build up this list, and you should start doing this come January if everything stays the same. Or if it changes, you should also do it, so that come November of next year, when the annual enrollment kicks in on November the 1st, you have 100 or 200 or 300 people ready to go. Okay, so now let's look at what you need to make sure that you know. Okay, number one, the product name. It is very important that you understand the product name. The product name, those names are long, and there are reasons, and they have numbers, the 4th, the 3rd, the 5th, okay? They have numbers, and those numbers make huge differences in things. So you need to make sure that you know exactly what is the product name. And when you sell them a new plan for 2021, you need to make sure that you write down the full length of the product name, because there is a difference between one. Some products look almost exactly the same. For example, number 4 might not include vision, and number 5 includes vision. That's it. That's the difference between the two products. And if he tells you that he wants the vision, the product with vision, and you sell them the one without vision, you're going to end up in some type of discussion. You didn't notice that 4 had no vision and 5 had vision, just to give you an example. So again, the product name, very important. The subsidy amount. How much money is the government giving you as a subsidy? Some people don't understand this. Let me tell you, when agents want to do things the wrong way, they play around with people's subsidies. They lie to the federal government, and they give the wrong information so that people get more subsidy than what they should get. Okay, guess what? They will catch up with them. And then there's going to be a huge problem in terms of penalties, and they're going to charge them for all the money that they received without being entitled to that and all that. So people need to know exactly the amount of subsidy that they received, okay? So they need to know. If they don't know, right there, you have a red flag in terms of a lousy agent who gave them guidance last year, okay? Because people need to know exactly what is the amount of subsidy that they're getting. Some people say, what is a subsidy? Well, $100. No, sir, $100 is what you are paying. But so the cost, the product cost $100. No, sir. That product that you have for you and your family cost the premium, the monthly premium is $1,000 a month. But you're paying $100 because you're getting a subsidy of $900 a month. Okay, and that subsidy is based on the information you provided to that agent. And if you provided the wrong information, or the agent ended up making up some numbers, when they find out the situation, they're going to come back to you and you're going to probably have to pay some money back. So the subsidy amount, very important. Now the pocket premium, this one normally they know. Okay, normally they know because they know how much they're paying, hopefully. Okay, oh, well, it's $72 a month, so $47 a month, etc. Now, this is very important. We have already started seeing some the arrangement in terms of the prices for next year. We're starting to see information that is being provided to us by the carriers and all that. So we're starting to get an initial idea of how things are going to look next year, okay? And the differences are going to be, in some instances, very small, okay? So again, very important, because, for example, if the difference in price between two products is $50, but the difference in what they have to pay is $10, which is different from the difference in price. One product is priced at $900. The other product is priced at $950. There's a difference in price between the two products of $50, okay? Now, if the client has to pay $10 on one and $60 on another one, now he thinks that he's paying a much bigger amount of money. But the difference between the two products can be huge, okay? So again, the amount of money that they're paying has to be, sir, you're going to pay $60 more, okay? But you're getting much more with this product than with this other product. So again, you need to understand the pocket premium and then the total monthly premium. I invite you all to make sure that you diligently discuss with your client the monthly premium so that they know how expensive these products are. People don't even realize the fact that the health insurance that they have costs $1,600 a month. They don't know that, okay? Now, let me tell you why it's important that they know that it's $1,600 a month. Because when you realize the fact that your health insurance actually costs $1,600 a month, then you're going to make sure that you use all those preventive services and that you use all the things that are inside the package. Okay, so you, oh, wow, this is an expensive product. Let me see all the things that I have there. Okay, if they think that it's $100, they disregard all the preventive service and everything. They don't understand that they're part of the package, because they cannot understand that by paying $100, they can have so many things. Okay, so that distorts everything. So make sure that you emphasize that monthly premium, sir. The monthly premium for this product is $1,400 a month, because this product is loaded with benefits for you. We need to make sure that you understand what those benefits are so that you use them, sir, because there is a lot of preventive services that we need to make sure that you and your family start using so that you have better healthcare management, okay? So that's part of the conversation. Remember, what you want to do is you want to build that relationship, okay? So that's part of it. Then you have the deductible. Very important. What is the deductible? That some products have deductibles by different silos that they create inside the products. We were watching some products this morning, and many plans are moving away from the concept of the deductible, and they're just paying some type of copayment for the service. Then what is the maximum out of pocket? Now, this I here stands for individual. So the maximum out of pocket per person. Then you have the maximum out of pocket for the whole family. Normally is 3 people. So if there's a family of 5, the maximum, the deductible, and the maximum out of pocket is for the first 3 individuals of the family. So once 3 people use their maximum out of pocket, the other family members do not have any type of deductible. So very important. That's why we have that I there. That's the deductible on an individual basis and the maximum out of pocket on an individual basis. The network, the type of the name of the network and the type of network. It happens a lot that you call a provider, sir, do you take Ambetter or Molina? And they say, yes, I take Molina. But guess what? They take Molina for Medicare Advantage, but they don't take Molina for ACA. They have two different networks internally. So you need to make sure that you get familiarized with the name of the network, because you need to make sure that they take and that they use the network for the product that you define up here, okay? So the name of the network, very important. And then what is probably the most important component here is the PCP name. You need to make sure, and this is a very important part of everything that you do, you need to make sure that here, that you identify a primary care physician for them. You need to discuss this topic with them at the time of enrollment, okay? And you need to look for whatever they want, okay? Now, you need to have your own order and your own priority on that. So, for example, I would say first thing, language. If they want them in English or they want them in Spanish, make sure you take care of that, okay? Number two, gender, male or female. You know, some people, they want a male doctor or they want a female doctor. If it's not an issue, it's not an issue. I would say something that is absolutely important, probably one of the most important things for me is distance. How close from my house do I have my doctors? I want them to be close by to my house. My primary care physicians, I want them as close by as possible. So I always, and that's how I do it, okay? I always look for somebody that is close by, and then I use other criteria. Now, if they have some type of criteria that overrides everything you are saying, that's okay. No, I want that doctor that is on the other part of town because I trust that doctor. Okay, let's see if that doctor is in the network, and then you use that doctor. Okay, so that's how. So again, PCP name. Make sure. In some instances, you can assign the primary care physician right when you are enrolling people. In other instances, they have to do it after they have paid and they have done the whole thing. But you do discuss it at this time when you are meeting with them, and you identify it. And if possible, you even describe it. You know, there is a code that the PCPs have. You write it down here, okay? And if it's tentative, you put tentative. This is the one that I am recommending, located at this address. You can write that in the back, etc. And then, again, if you have power of attorney, you could get their, no, I'm sorry. Here, you put your FFM subscriber ID. Very important that you put your FFM subscriber ID here. Why? Because they might do changes later in their house by themselves, and you need to tell them, sir, anytime you do any changes, you need to make sure that my FFM subscriber ID is there. Because if you take that out or anybody takes it out, I am not your agent of record anymore, and I cannot help you. Additionally, I don't get paid anymore. So the client needs to know your FFM subscriber ID here. Because, by the way, you're going to give them a copy of this document. You're going to keep one of these for you, and you're going to give them a copy of this document, okay? Once it's completed, once you completed the whole process, you need to make sure that the client knows what, and by the way, FFM stands for Federally Facilitated Marketplace. FFM, Federally Facilitated Marketplace Subscriber ID. You and your client need to have absolute clarity about what your FFM subscriber ID is and what is it, okay? Because they need to enter that if they're doing things by themselves on the account. So this is the 2021 ACA product review. I want you all to download this and start working. If you already have clients, make sure you start filling this form for 2021. And let me tell you, I don't write business anymore because I'm, it takes a lot of time to service these people, and I want to make sure that if I'm doing it right. I don't have the time anymore for that. Okay, but the point is this. Okay, you need to make sure that you have all this information and that you have it handy. So whenever I start a conversation with anybody that wants to get enrolled, the first thing I do is I pull out the 2021 ACA product review. I immediately bring out a blank one, and I start filling it, completing it. Okay, and I take notes in the back or whatever. But this is the first thing that I pull out is this document whenever I'm starting with a new client or whenever I'm reviewing an application with anybody else. So this is the first thing you do. You pull out one of these blank forms and you start completing it for next year. Now, you start asking the questions and you try to complete as much of this part here as possible. Okay? And every time that the client says, I don't know, that's a level of measurement of the quality of the advisor that was helping them in the past. You want to change that. You want to make sure that they know everything about what you are doing with them for 2021. Okay, so that is the 2021 ACA product review. Now, finally, I'm going to give you some assignment. Okay, so let me go back to the presentation. Let's going to finish now. We said we were going to do it for 1 hour. I know have a little bit longer than that. Okay, but let me tell you what I want you to do. Remember that I told you one of the companies that we own is called the American Institute of Digital Marketing, and the website is www.amidim.com. This one, amidim.com. www.amidim.com. So it's there in the presentation. And what I want you to do is I want you to go to www.amidim.com, and I want you to register in this course that is called Selling in the Healthcare.gov Marketplace. It's at no cost to you, but it's a fundamental course for you to get ready to sell for 2021. It's a very important course that you need to go through. Okay, so now I'm going to show you how you go there and how you register. And again, it's at no cost to you, but it's what we have done is we have put together all these videos and all this training by CMS, high quality videos, and we have put it in a certain order, and you're going to go through it. It's going to take you 2 or 3 hours to complete the whole thing. But once you finish that, you're going to be way better in terms of knowing what you need to do and all the different scenarios that you can run into with these clients. Okay, so that's going to really help you a lot. So let me show you where you're going to go for your assignment. I'm going to get out of here and I'm going to go to, I'm going to open a new tab here. I'm going to go to www.amidim.com. And Amidim is the website for the American Institute of Digital Marketing, which is another one of the companies that we own, as I mentioned to you at the beginning. Okay, and then you have different tabs here. You're going to go to the store tab here, and there's where you're going to register. But then once you register, you're going to come to here where it says My Library, and you're going to see it there, and then you can log in through My Library. My Library has all the different courses that you have registered for. So I'm going to click on the store tab here. I'm going to click here, and that's going to show me a list of a lot of different courses that we have there. And what I want you to go is to this one. Selling in the healthcare.gov marketplace is free of cost to you. Selling in the healthcare.gov marketplace. You're going to click on it and you're going to register. Okay? You're going to enter your email and you are going to register. And then once you have registered, you're going to come back and you're going to click on My Library, and I'm going to do that on my account. Okay? And it's going to show you, oh, I'm sorry. I don't want to do that. I don't want to register again, okay? So I'm not going to register because I have registered too many times. Okay, but again, you're going to go to My Library, okay? And you're going to see the course, and you're going to click on it, and you're going to start, okay? And again, you can complete it in one. Some agents complete it, they complete it in one session, and they send me a message saying, hey, Al, this was really good. That really helped me, man. It gave me information on things that I have been lost for 4 years, you know, and it was a really good review of the whole thing. So it's a really good course that we have put together for you at no cost to you. So that is the assignment for the next session, okay? So now remember, let me just open this thing here, that We're going to be meeting again for the second leg of this training next Friday at 10:30. You need to register, okay? You need to register for the, in order for you to register, what you do is if you go to the Prinsuco website, and if you click, all of our websites always have a tab that is called Come and Learn. Come and Learn. Come and Learn. So you're going to click on Come and Learn, and you're going to see there, this is the training that we're going to be having on Wednesday for digital marketing. So you register here, you click there and you register, and now you're registered for the Wednesday digital marketing training. Remember, it's parallel to this ACA training. And then come tomorrow, you're going to see a tab here that is going to have the registration link for next Friday's ACA training, which is session number 2 of this training that we have completed today. So again, I want you to do 2 things. Number 1, go to the AMIDIM website. The AMIDIM website, AMIDIM, remember, stands for the American Institute of Digital Marketing, www.amidim.com, American Institute of Digital Marketing, and you're going to register for the sellinginthehealthcare.gov marketplace course, which is free of cost to you, and you're going to go through that training. Okay. Additionally, you're going to download the 2021 ACA product review, and you're going to start playing around with that and getting acquainted with that form and start completing that for all of your clients. That's job number 2. And then job number 3, you're going to register for next week's session that is coming up next Friday. Let me just show you the agenda for next week. Let me show from current slide. So the agenda for next week is we're going to show you some more Prinsuco resources, things that we have available for you. And then we have a detailed ACA presentation that covers multiple aspects associated with the law. And additionally, very important, you're going to be able to take a couple of those slides and you're going to be able to record videos on those specific topics. Okay, and then you can promote that, and we're going to teach you how to do that when we get into digital marketing session number 3. So session number 2, very important, because you're going to learn a lot, and we're going to provide you some proprietary materials, images, and concepts that we have developed associated with the Affordable Care Act that you're going to be able to use in your digital marketing, promoting your business. So I'm looking forward to seeing you every Friday from here till the end of October at 10:30 in the morning for the ACA training. And I'm also looking forward to seeing you on Wednesdays at 10:30 Central Time for you to learn how to use digital marketing. We're starting this coming Wednesday with digital marketing applied to ACA marketing, okay? So again, everybody, thank you very much. Looking forward to seeing you next week 2 times. And make sure that you complete all the training that we explained to you and that we assigned to you, because this is going to help you get ready for everything that is coming, and it's going to help you make more money next year. Again, everybody, thank you very much.